Welcome back to another episode of the Digital Health and Wearable series. Today I have another magnificent leader and guest for you, but before I go ahead, make sure you subscribe to the channel and share this magnificent content with your communities in healthcare. But let me acknowledge our series partner Salesforce, leaders in healthcare and life sciences, and also our global partner Spirit Digital. But without further ado, very excited to introduce you to Sam Shah, which is the Chief Medical Strategy Officer at Numan. Sam, how are you?
I'm great. Thank you for inviting me today. I'm really looking forward to our chat. How are things going for you?
I'm doing well, yeah, fairly busy, I'm glad the world is kind of slightly adjusting again, and
Yeah, I think it's quite nice that things are beginning to change and hopefully change for the better.
I agree. And I've been following your great work for quite some time. I know you're involved with a number of things, but I follow your NHS leadership stuff and everything. So you've been doing some great things. I'm pleased to have you here.
Oh, thank you.
So we go straight to the questions, and the first question that I have for you is, what's important when talking about consumer facing digital health?
I think this is such an interesting question and topic area because when we think about health and we think about consumer, the two things don't naturally go together. Certainly not in a place like the UK. Often for healthcare professionals, people think about the patient. For citizens, they might think about themselves as citizens. But ultimately, in some form, they are consuming something. Now, in old world, that might have been a service. Today, we might call that a product. When we think about consumer facing health and consumer facing digital health, for me, it's about making things more accessible to a person and making it almost as accessible in the same way that we can go to a shop or go to an online store these days or anything else that we want to try and consume and use. Is trying to make healthcare as easily accessible as that. But of course, comes with a balance. Healthcare is scarce. There's far more demand than there is supply. So you've got to work out how we create a citizen public facing offer, which means that it both balances the demand, but at the same time makes a service more accessible. And I think that's a really fascinating conundrum problem that we have to solve in consumer facing healthcare. But the really interesting thing is how we join up other parts of technology, data, to make that new interaction even more meaningful, to take it beyond where it was being very transactional in a clinician, patient facing environment to one where the citizen as a consumer is far more in control.
Oh, fantastic. Sam, thank you so much for that. With the previous guest, we're discussing the digital world and not just digital health, but digital in everything we do. Our consumer behavior as people. We shop online, we look at things online, look for information online. So thank you for those insights. And the question number two is, what are the main challenges to meeting users' needs, especially in the current climate with so many lockdowns?
Once upon a time, globally, we had a sort of one dimensional approach to assessing needs in healthcare. We very much thought about needs as being normative need, felt need, perceived need. Those are the sorts of things, even corporate need, we used to think of in healthcare. And that's very much driven from a clinician, public health sort of perspective, which is, of course, incredibly important. But in that, what we often forgot were the other needs. We often forgot about the emotional need. We often forgot about the practical need. And these are balancing factors in needs that are often left out. And so when we think about digital healthcare, we think about consumer facing healthcare, we even think about any form of healthcare, getting the design of a service is incredibly important because if we look at system failure, a lot of the reasons for system failure are because we haven't really designed those systems and services around the needs of the users. And when I mean users in healthcare, I think about both the patient, the citizen, but I also think about the clinicians and the workforce in that as well. So getting really understanding user needs and taking a different lens to user needs in healthcare is more important now than ever. And particularly when we think about what happened in lockdown, we all changed to a different way of interacting. Like even in my own practice, which is very surgically orientated, we even did a lot of our consultations online, which is very new for us. And so people are now used to behaving in a different way. Clinicians have modified their behavior. And the needs that we're now seeing are very different to the needs that existed before the lockdown period. But that comes with a caveat. We've got to be really careful that we don't assume that what worked during lockdown is going to work when lockdown ends. The necessity for people to socially distance meant that we drove a certain behavior and need around using online channels, but actually, that online channel may not be right for everyone in normal circumstances. It may have been the circumstances of lockdown and COVID that made that channel more useful in that environment. But now, as we come out of this, we have to recognize the hybrid, the mixed needs, and really get into the depth of different types of users. So the needs of a transplant patient having a post-operative follow-up might be very different to someone needing routine elective surgery, for example. The needs of somebody requiring elective care, for example, who's had a fracture or some emergency, might be very different to somebody that is known to require surgery for a chronic condition of some kind. Or even if we take other areas of what we used to call outpatient care, given we've moved to this virtual world, the needs of the citizen may have also changed around thinking about services built around the citizen. Whereas they previously, in our health systems globally, it was very much you go and see a family physician or a primary care physician or someone in the community who then refers that person to the next person in the chain. But actually, for the citizen, that may be meaningless now because the care almost has to surround that citizen. So when thinking about those needs, we have to move beyond thinking about the old world of needs and blend in the new world of the emotional and the practical need for the individual, but also thinking about the environment in which they operate outside of COVID.
Oh, brilliant. Some fantastic insights there. And you mentioned so much at the beginning. You mentioned that considering the user needs and involving them in the co-creation of the products and designing the service and product, which is often forgotten, as you well know.
Right.
Now there are companies just specializing in that, doing the co-creation bit. They might not be specialists in digital or even in technology, but they're doing the co-creation, bringing everything together. But very important what you mentioned. What is right for a period of time, it might not be right after lockdown, and everyone is different. I was thinking about personalized healthcare, the individual needs. Is so much to consider. There's some. We could have a conversation just around that question. We can have an hour's interview just around that. Anyway, exploring that. But moving on to this third and last question, which I believe leads really nicely because you mentioned the behavior, even the culture, certain things to consider. And the third and last question is, what are the crucial basics to be successful with digital transformation in healthcare?
Well, the $1 million question, not an easy one, but I certainly have a perspective on this. The first thing is almost not starting off with digital, maybe not even starting off with thinking about transformation, but just taking it back to the last thing we discussed, which is what are the needs and problems that need solving in the system? And then alongside that, working at how can we do it differently that takes us not just from transferring it, from doing it in an analog way to a digital way or to some other modality, or even changing channels, but thinking about how do we leverage the opportunity to improve something, make it better. So take a combination of improvement science, a combination of change mentality, if you like, and even taking behavioral science as an approach, bringing that together and first applying that lens to something and working out what are the behaviors we want to change, what's the improved outcome we want, and how do we want things to be different. And then working out, could there be a technology way of supporting this or enabling it that will improve it and accelerate it beyond where it is? And then finally, trying to create that, what we might today classify as digital transformation. It may not be called that. Its name might change, but really thinking about what we do, that if we were to use technology, that we're not going to widen inequalities or inequity, but we are going to be able to somehow at least reduce it or maintain it. But the very most important thing is improve outcomes. and then taking all the benefits of the internet era, taking the benefits of being data driven, using the power of the internet, even thinking about where, if possible, a connected device may make a difference, provided it adds value to the individual, and applying those things. If I take any program, any major program where we're doing this, bringing about this change, three things get forgotten. The first thing is there is often not a strategy. People haven't thought through for a period of time where they want to get to, how they want to get there, and what the aim is of something. They often get distracted by shiny technology, by new devices, and trying to work out how do we plug that in to make that the change, as opposed to thinking about where do we want to be that's fundamentally different and a better outcome. The second thing is getting the design right. Whether that's the design of the ecosystem, the design of the infrastructure, the design of the team, the design of the experience they want someone to have, that's often missing. And the final thing, which I think is really fundamental, is getting the tools, the resources right. That's down to getting the right people, getting the right resource to make the change happen, and even thinking about the right technology, if that's what it's going to be, and taking time to evaluate it. Often those things are missing. So for digital transformation, for me, it's about solving a problem first, then working out how we could transform the experience, and then finally getting to the stage where we might apply technology. And if we're going to do that, get those three things right.
Oh, fantastic, Sam. Thank you so much. Really important things you mentioned there, and I like the way you started. Technology might not be considered right at the beginning because we try very much to kind of fix it with the product or with the technology, isn't it? But you mentioned reflecting on that. You mentioned a well thought through strategy, the importance of the design with what you're trying to achieve, and finally the resources, which many things come that umbrella, and it could be even the technology fitting in around the resources. Thank you
And
so
when
much.
you're welcome. And when I mention those things, the thing that is probably almost inherent in all of this is involve people. Involve the citizens out there, involve the clinicians working on this stuff, involve the workforce, get them involved in this so they feel part of it, they're part of the decision making, and make sure that the people that are involved really reflect our population, reflect every segment of our population, because the experience of somebody living in the north of England, the experience of a single parent will be very different to a family. All of those things have to be factored in, and often when we go through these change programs, it's not even necessarily reflecting the needs of those individuals out there that matter. So I think that's really important.
Fantastic, Sam. Thank you so much. A lot of value for our viewers and listeners. Really, a bit of free consultancy there, right, Sam? But anyway,
Oh,
Sam, I appreciate you. I know you're busy. I appreciate you are here and your expertise, your insights, and everything. Before I round up, I finish all my episodes in a peculiar way. It's not really a question. It's 1 minute of fame. Okay, so over to you. You can talk about anything: a personal achievement, professional accolations. You got so many, a family. I mean, anything. A colleague, a shout out to a company, anything whatsoever. 1 minute of fame. Over to you.
I want to say a massive thank you to all the people I've worked with in the health service, in the technology sector, and everyone out there that's doing a fantastic job, especially over the last year. And I can certainly say that my teams I work with delivering urgent care during COVID have been absolutely fantastic over the last year. I couldn't have done my job without them, and lots of people benefited from the work they did. So, massive thank you and shout out to all of them, whether it's in my digital teams, in my physical teams, my surgical teams, all of them. They've been great.
Somewhat a way to finish. Thank you so much. Let me
Thank
thank
you.
you. Let me thank you again. Thanks for being in here. Magnificent insights. And I'm gonna round up now. Thank you, Sam.
Oh, you're very welcome. It's been a real pleasure speaking to you today, and I really hope that people get some insights from that discussion.
Sure. Thank you so much. And I'd like to thank our viewers. Make sure you subscribe and acknowledge our series partner and global partner again. And I'll see you all next time.